Okay, well, we've got some amazing sessions coming up for us in our Quality Leaders series. Just a few posted on here for you to take a look at. I do want to highlight a really great opportunity. We will be offering a special free CEU event, and we have Evelyn Cook-Spice Infection Prevention coming in to present for us. So really good opportunity, get some good CEs, and I've not had the pleasure of listening to Evelyn speak yet, but I hear she's an amazing speaker. So please mark that on your calendar. It is an off day for us, so we will ensure that we send that registration link out. And as a reminder, just kind of put that in there. If you haven't had a chance to sign up for our Quality Leader session, please enroll and accept all of the series. Even if you're not able to make them, at least they're on your calendar in case something happens, you're able to join us. But some really good information coming forward on disaster preparedness. Next session is on understanding the staffing metrics from the 5-star perspective. Really important information because that all changed in July. So you're starting to see the impact in the 5-star reporting now. So getting and digging into that and understanding how it's driven is going to help us strategize and operationalize to that. Our own team here at CCME is going to do some great presentation on our sepsis work group, as well as our Leadership Academy. And if you're not familiar with the Leadership Academy, Beth Herscher is in phase 2 of her research project, looking at stabilization of the workforce in South Carolina nursing homes. And so if you're interested, just kind of put a little plug out there for you and let us know. There is the opportunity to sign up for consideration in our phase 3 rollout this fall. So we're looking for some additional buildings to work through the process. So if you're having some opportunities in workforce development or interested in this, let us know. We'd be happy to have you send us that information and talk to you further about next steps. Without further ado, I want to thank Chelsea Campbell for coming on and speaking with us today. Chelsea is from DHIC and will present on antibiotics. I do want to make sure I scan this over. My apologies, I'm still not that great with technology, but I think we're going to have it figured out for us here quite shortly. Chelsea, if you'd like to take over the screen. Perfect. Looks like we're viewing your screen.
Okay, great. Can you hear me?
Yes, ma'am.
Awesome. Well, good morning, everyone, and thank you for the introduction. Again, my name is Chelsea Campbell. I'm the Healthcare Associated Infections Antimicrobial Resistance Pharmacist here at DHEC. That's a lot. This is a new position, and I was hired to develop and incorporate stewardship activities into our program, including conducting surveillance to better understand stewardship practices across facilities and provide education and tools around stewardship for facilities here in South Carolina. Let's see, I've got a little, oh, can you guys see the next slide? Okay. So I wanted to start with a quote that I found when I first started researching antibiotic stewardship programs in long-term care settings. And it was in McKnight's long-term care newsletter. And it let us glory in living in a time when antibiotics can save us from death related to infection, but let us also recognize that they are not to be trifled with, by Elizabeth Newman. I like this quote as we can appreciate our advances, but also be cautious. I do have a few objectives for today's presentation. First, I will provide an overview of the Healthcare Associated Infections section, also known as HII, here at the South Carolina Department of Health and Environmental Control, DHEC. Then I will discuss DHEC's new long-term care antibiotic stewardship initiative, and lastly review current and future antibiotic stewardship projects. So I know there are a few DHEC people on the call, but DHEC is huge. So I wanted to kind of go over the organizational chart real quick. Again, we are a state agency. We probably have about 3,500 employees in 100 different locations throughout South Carolina. So because DHEC's so large, I kind of like to think of it as an umbrella with several programs, bureaus, and divisions under it. So we are in the Public Health Agency, and within public health, we are in the Bureau of Communicable Disease Prevention and Control, in the Division of Acute Disease Epidemiology, and in DHEC, that's known as DAID. And DAID has several sections within it, including us, the Healthcare Associated Infections section. So I want to briefly give an overview of the HAI section goals and projects. I know a lot of you probably already know this, but elimination of preventable healthcare associated infections across healthcare settings is of course our major goal, along with a lot of health departments, and prevention or prevent the emergence and spread of multi-drug resistant organisms. And in order to do this, there are a number of projects that help us reach our goals. So we offer outbreak assistance. We also offer training and education on basic infection prevention and control practices, on-site assessments of IPC plans, policy, and practices to strengthen IPC programs, and then of course guidance in the development, implementation, and maintenance of antibiotic stewardship programs throughout South Carolina. So again, all of these projects really help us towards reaching our goals here in South Carolina. So funding. We are predominantly funded through the CDC, specifically the ELC program. And the ELC program funds about 64 health departments in order to help detect, prevent, and respond to infectious disease outbreaks. And another source of funding for the HAI program is the Strengthening HAI-AR program capacity, also known as SHARP, which I'm sure a lot of you are familiar with. SHARP is also awarded to the same 64 ELC recipients. There are a number of projects within SHARP, but my project is Project 3, Antibiotic Stewardship. So Project 3 aims to provide access to stewardship expertise, especially for settings where inequities exist, and provide support through a number of activities. These activities include, of course, implementing the CDC core elements, tracking and reporting antibiotic use, establishing and supporting antibiotic stewardship collaboratives, and also implementing stewardship activities to help improve prescribing practices. I couldn't do my presentation without an introduction to our team, which I think our team is amazing. Let's see, so Allison, of course, is our section director, and then we have an HAI coordinator, an MDR program lead. We have a nurse educator for Project Frontline, First Line, 2 EPIs, 4 nurse consultants, and then a medical consultant that also works with me on the stewardship side, and then of course myself. So we have a wonderful team, and I'm sure a lot of you are familiar with the majority of these. So why antibiotic stewardship? So antibiotic stewardship plays a key role in antimicrobial resistance. Per the CDC's 2019 Antibiotic Resistant Threat Report, antimicrobial resistance is an urgent global public health threat, killing at least 1.2 million people worldwide and associated with nearly 5 million deaths in 2019. In the US, more than 2.8 million antimicrobial resistance infections occur each year, and more than 35,000 people die as a result, costing more than $4.6 billion annually. Antibiotic stewardship programs can aid in the responsible use of antimicrobials, which can improve patient outcomes, reduce healthcare costs, and potentially impact rates of antimicrobial resistance, which is why antibiotic stewardship is so important. So why long-term care? If we remember back a few slides, Project 3 aims to provide access to stewardship expertise, especially for settings where inequities and stewardship support exist, which is why we're focusing on long-term care nursing homes. Now, keep in mind, we do offer support to other types of facilities, but our current goal is to have a sustainable long-term care initiative focusing on nursing. There are many barriers to implementing effective antimicrobial stewardship programs in long-term care settings. I'm sure you're all familiar, including limited financial resources, limited access to physicians and pharmacists with antimicrobial stewardship training, high rates of staff turnover, and don't forget, 4.1 million people are admitted to or reside in nursing homes per year. Studies have shown that up to 70% of nursing home residents receive antibiotics per year, and 40 to 75% of those antibiotics may be unnecessary or inappropriate. This number is up from 25 to 75% in 2000. Therefore, CDC recommends that all nursing home facilities or nursing homes take steps to implement antibiotic stewardship activities. So, with such a huge importance to improve antibiotic stewardship programs in nursing homes, knowing there's a large number of barriers that nursing homes face, we have developed a long-term care antibiotic stewardship initiative. to provide guidance and tools to help nursing home facilities sustain successful antibiotic programs throughout South Carolina. Our primary goals for the long-term care antibiotic stewardship initiative is to gain a better understanding of nursing home antibiotic stewardship programs throughout South Carolina in order to identify implementation gaps and areas that may need improvement. With this knowledge, we can develop interventions and provide guidance to help nursing home facilities sustain successful antibiotic programs. It's easy. It might be easy to have one for 1 year, but we're really looking to help aid in sustaining them for the long haul. So in order to reach our goals, we have developed a statewide annual antimicrobial stewardship assessment survey to help evaluate facilities' current stewardship programs and to establish a baseline for future surveys. We hope the survey will be completed annually, which will allow for us to follow facilities from year to year, to track progress, establish areas for improvement, and advise as needed. Currently, our surveys are being completed during site visits that we have established through our regional IPs. And as we continue to network and grow, we hope facilities will reach out to us directly for guidance. So our overall goal for the survey is to provide the guidance needed to help facilities have effective and sustainable antibiotic stewardship programs. So our annual antimicrobial stewardship assessment survey, very long, is based on the CDC's 7 core elements. I know y'all are probably familiar, but leadership commitment, accountability, drug expertise, action, tracking, reporting, and education. And those last 3 are the hardest for facilities to implement. They're very financially expensive, and they're very time consuming. So we also have some additional questions that we felt would help us assess current efforts in stewardship and to bring to light possible barriers that facilities may be having. So as of today, our survey is being completed through a fillable PDF, but in the coming months, it will be uploaded into REDCap, which is through CDC. So basically, it will be a link that we will be able to email people, or they can go to the website and just click it, fill it out, and submit it. Very easy. So I'm not going to go over all the questions on the survey, but I just kind of wanted to hit the high points, especially section 1, which for me, I think is very important. This data in section 1 will be used to look at inequities and kind of be a way for us to compare facilities with each other. It wouldn't make sense for a large hospital-associated nursing home to be compared to a rural nursing home. That's not really going to benefit anybody. So in this section, we're looking at how large is the facility, so daily census, ownership, certification, affiliation. We would like payer percentage breakdowns, and then some information about staff. So we want to look at staff. We can look at staff and staffing issues and even payer status and see how that might affect stewardship practices. Section 2 has questions on leadership support and accountability, because as we all know, if leadership is not on board, it will make it very difficult. Section 3 will look at whether or not there's an established antibiotic stewardship expert. 4 is looking at what activities are being done to improve antibiotic use. And again, if you can see, the questions are not necessarily here to make someone feel inadequate. It's just looking at where you're at and are there areas that maybe we can help you with. And then section 5 is questions about tracking antibiotic use and outcomes. Again, if you are a larger facility and you've got tracking that can be done electronically, that's easy, not very time consuming. But if you're a smaller facility that's having to do this manually, it's a whole different story. So section 6 is looking at if facilities report antibiotic use and resistance data to staff. So again, that was down with the 3 elements that are a little bit more difficult. If you have data and you're not using it to then share it with your staff, that's an area that could really be improved upon. And then section 7 is focusing on education. So again, this section can also help us. I'm sure a lot of our interventions will probably be educational, and we want to know what you're doing with your staff right now and how do they like their education? Do they like people in person, or do they prefer something on like a webinar or something? Section 8 focuses on challenge and barriers in facilities' current stewardship programs. I think this is going to be the hardest one. I know that people are probably a little weary to fill this out, but making sure that we let facilities know that this is anonymous and people are not going to find out is important. And I also think our site visits are helping for us to build relationships so that facilities can trust us. We are not the regulatory side. We are just here to help and do the most that we can. And then the last sections are kind of in-house questions. Section 9 is just asking what they do with their health record, what's available. And then section 10, of course, is PPI usage. And then section 11 is lab and dialysis. And then the bottom is just a section for requesting assistance. And then you can't see it, but underneath that is my contact information. I'm predicting 3 outcomes for the survey. I think 1, facility may not just want to fill it out at all. 2, they will fill it out, but they don't want any help, which is okay. And then section 3, or third outcome, would be that they fill it out and they want help. So hoping for 3. All right, so I'm also working on developing an antimicrobial stewardship page on our DHEC HAI website. This page will have several resources and tools to aid in the development, implementation, and maintenance of stewardship programs. Right now, there are so many resources out there, but they're in 100 different places. CDC absolutely has a great database of resources, but a lot of health departments have even better resources. They have tools, template letters to start a stewardship program from the bottom all the way up to, gap analysis tools. And so I'm hoping to be able to put all of this in one spot. So if you are, outcome 1 or 2, and you don't want our help, then you can at least go to our website and there will be a ton of resources to help you. Resources will include, of course, the core elements of antibiotic stewardship in nursing home and all the other facilities. We're hoping to have antibiotic stewardship guidelines and interventions, the gap analysis tool that I just mentioned, antibiotic use protocols, which are incredibly important, and resources for monitoring, reporting, and educating antibiotic usage will all be on our website. So some of our future projects. So we are in the process of developing the South Carolina Antibiotic Stewardship Honor Roll program for long-term care facilities, designed to recognize facility programs for their commitment to antibiotic stewardship. It will most likely be a 3-tier program showing commitment, action, and collaboration, and participants will be published on our HAI-AS website. We hope that this program will encourage antibiotic stewardship commitments, provide an incentive for improving programs, and help publicize the importance of antibiotic use responsibly. Having it on our website will allow facilities to be able to look it up, but also for patients and patients' families to see that that facility is doing everything they can to improve antibiotic usage. We also plan to start a long-term care collaborative work group that meets monthly or as needed to discuss antibiotic stewardship topics in long-term care settings. And next year, we hope to offer a workshop focused on antibiotic stewardship pearls, as I say, with mentors from nursing homes with successful stewardship programs, leading roundtable discussions with facilities that are looking for ways to improve their stewardship practices. In my mind, I'm thinking nursing homes that are owned by corporations that have 7 or 8 throughout South Carolina, coming together and helping independently owned nursing facilities. And we're excited about our new initiative and to offer as much support as possible to help antibiotic stewardship programs in South Carolina. I think I went through that pretty fast, but any questions? And then I also have a slide with contact information. Please feel free to reach out if you just have questions or comments. I would love to hear from y'all.
Thank you so much, Chelsea. That was so interesting. For everyone that's joining us, please, if you're interested in writing a response or a question, type it in the chat box, or you can also ask to unmute, and we're happy to have you join us and talk through any questions or comments you have as well. So I think, Chelsea, one of the things that I really picked up on when you were presenting on this was how impactful this really is, not only from the annualized cost that we see to the healthcare system, but even to think that 40 to 75% of facilities are inappropriately using antibiotics, and that's up 20%, even considering we've been changing our regulations over the last several years. That's so surprising to me.
Absolutely. And I think a lot of it comes down to a lot of the barriers and people, staff, they're overworked. And this is not that it's not important, but there are so many other areas, and especially with COVID. So I'm really hoping that facilities will take advantage of us and allow us to come in and really help. And we have been to a couple of facilities already, and they have been very excited to have us and very welcoming. I think one of the important things for us is to establish these relationships and to help people understand that we're not the regulatory side of DHEC. So I'm excited.
Yeah. Well, it really helps us to get back into a return to the basics, back to how we did things pre-pandemic. It's, wonderful to have the support and resources of DHEC to help us tackle some of these topics that in the last 3.5 years have been important to us, but maybe not the priority. We're trying to save lives and prevent infections from happening. It's a good opportunity. It's a new day coming into a new month of June to really be able to back up, regroup, and refocus. And the point that you said in the assessment on how are we bringing this information to our staff and sharing that with them, that's gonna. I think that's gonna help our staff be able to get more comfortable in making those transitions as well.
Absolutely. And I think the CDC, of course, offers amazing suggestions and tools, but none of those are focused. They're very general. And it's really important for people to see that even looking from hospitals to acute care to nursing, there's so many different resources. And so a lot of these are focused towards, if you have everything lined up in a row, this is what you'll be able to do. And so being able to come in and really, make a program specifically detailed for a facility and their needs, I think is really exciting.
Yeah, wonderful. I want to reach out to anybody else if you have any questions. I could talk to Chelsea all day long, I'm certain. But if you have any thoughts or questions, feel free to jump on in the conversation as well.
And if you think of anything afterwards, please feel free to reach out.
Chelsea, this is Chris. And I know you spoke to the fact that you're still working on development of the web page. Are there currently some resources out there that people can go to in the interim?
There are. The CDC would probably be the best place for people to start. Most of my research started with CDC, and then I went out. But Tennessee and Minnesota health departments, their HAA programs are amazing, and they do have a lot of information also there. And I believe that both of those are mentioned on the CDC's webpage. But hopefully I'll be getting our website up and running soon. There are some documents that I need to make into DHEC documents.
Gotcha.
But yeah, CDC is still a wonderful resource for people.
Alrighty. I just didn't know if you had made any headway in getting anything onto the DHEC site yet. So thank you so much for being here and talking with us today.
It looks like Mary Lachlan added some information for us in the chat box as well. Mary is referencing the AHRQ website for that can be able to help with some smaller facilities. And while we're building up and developing the resources at DHEC, this might be another good tool to utilize and access.
Yes, that is a wonderful resource. Thank you for mentioning that.
That's the great thing about having these sessions in that roundtable. We've got a whole bunch of expertise in this little room here, and it's great to be able to share with each other. I'll just want to open just one more final call. Does anyone have any additional questions or comments, or any other questions or comments that you have that we should look into or we can help address? Happy to do that as well. We have thank you, Chelsea, for your great presentation. With that, we will close down the recording. Do want to just ensure that you are taking a look at the upcoming sessions that we have. We are excited to have so many wonderful and expert presenters in a variety of topics, really taking a look at how we can operationalize, how we can strategize around some of these regulatory requirements. How do we make them really part of what our functionality is for the benefit of our residents and the benefits of our staff members? So Chelsea, we are so grateful for your continued support and collaboration and for sharing this information with us. It's definitely helpful and is going to allow all of us some good information as we move forward to supporting our residents further.
Thank you again for letting me share.
Absolutely. Hope everybody has a fantastic weekend. Please stay safe and healthy, and we'll see you back here on June 8th.
Please be sure to fill out your survey so that we know how this impacts you.